Hi there, this is Emma. She's been living with atopic dermatitis, the most common type of eczema. Today, she'll be walking you through how to properly self-inject the 2 syringes that come in an Adbry tralokinumab-ldrm carton. Even though you may have learned how to self-inject with your healthcare professional and practiced injecting with the training syringe in your welcome pack, your first time injecting at home might seem a little intimidating. Don't worry, Emma is here to help you get familiar and confident with the process. She'll go over what materials you'll need, how to choose and prepare the injection area, how to self-inject, and how to dispose of used syringes. Before we keep going, it's important that you've carefully read the instructions for use that comes with your Adbry carton. If you haven't yet, pause the video and take a look. We'll keep going once you're done. If you have any questions, you can always contact your healthcare professional or the Adbry Advocate Patient Support Program at 844-MY-ADBRY. Let's get started. Before getting everything together, you'll want to have a clean surface for your materials. Now, here's what you'll need: a nearby sink to wash your hands, clean gauze pads or cotton balls, a sharps container, small bandages, an alcohol wipe. If you don't already have a sharps container, you can get a free one by calling the Adbry Advocate Program. Don't throw syringes or syringe covers away in a regular trash can. For now, you can use an upright household container, such as a coffee can or an empty laundry detergent container. It should be made of heavy-duty plastic, be able to close with a tight-fitting, puncture-resistant lid, and be leak-resistant. Label the container so you and anyone else that comes across it knows it has hazardous waste inside. When your container is almost full, follow your local guidelines on how to dispose of your sharps container. You can call your healthcare professional or visit the FDA website for more information. Take your Adbry carton out of the refrigerator. Check your carton's expiration date. Don't use if it's expired or if the seal is broken. Each carton contains 2 pre-filled syringes. Remember to keep your Adbry cartons in the refrigerator until you're ready to inject. Never freeze your syringes or use syringes that have been previously frozen. Keep Adbry and all medicines out of the reach of children. Let your syringes warm up to room temperature by leaving them in the carton on a flat surface away from direct light for 30 minutes. Don't try to speed up this process by warming up the syringes in the microwave, under hot water, or in sunlight. It's important you don't shake the syringes, remove the needle cover until you're ready to inject, or put the syringes back in the refrigerator once they've warmed up. Now that your syringes are at room temperature, check them for a few things. Keep in mind your syringe colors may be gray or white. Check the label and the expiration date. Make sure the syringes are not damaged in any way. Look through the syringe's viewing windows. The liquid inside should look clear to slightly pearly and be either colorless or pale yellow. It should not look cloudy, discolored, or have particles. If you have any questions about whether the syringe is okay to use, do not inject either Adbry pre-filled syringe. Give your healthcare professional a call and let them know that something is wrong with your syringes. And call 844-MY-ADBRY. Now that you've inspected everything, it's time to choose the area where you'll inject. Since there are 2 Adbry injections per dose, you'll be cleaning an area that will allow you to keep both injections at least an inch apart. You'll want to choose either your abdomen or your thigh. Make sure that you do not inject through your clothes. When it's time to inject your next dose, you'll want to choose a different area than the one you choose today. If you need to choose your upper arm as your injection area, you'll have to ask a caregiver to inject you. Make sure they read the instructions for use first, so they'll know how to do it. You'll want to avoid injecting in areas where skin is tender, damaged, bruised, or scarred. Skin is within 2 inches of your belly button. Make sure you wash your hands with soap and water before cleaning the injection area you've chosen. Today, Emma is choosing to inject her thigh. Take an alcohol wipe and clean that area of your skin. Wait for your skin to dry and avoid blowing on or touching the area that you've cleaned. When you're ready to inject, carefully remove the needle cover while making sure not to bend the needle. You might see a drop of liquid at the end of the needle. This is normal. Throw the cover away in a sharps container and never recap the Adbry syringes after you've opened them. Don't touch the needle or let it touch any surfaces. With one hand, pinch and hold around a fold of skin that you cleaned. With the other hand, insert the needle completely at about a 45-degree angle into your skin. Use your thumb to inject the medicine. Push down on the plunger head until you can't push it down any longer. Now lift your thumb off the plunger head. The needle will automatically move back inside the syringe and lock into place. Take the used syringe and put it in your sharps container. If needed, you can place a dry cotton ball on the area for a few seconds or cover it with a small bandage, as there may be a small amount of blood or liquid where you injected yourself. This is normal. Repeat step 3. Just make sure it's at least 1 inch away from the previous injection site and within the same area of your body. Nice job! Go ahead and dispose of the second syringe in your sharps container. Any other materials, like your alcohol wipe, cotton balls, or Band-Aid wrappers, can go in your household trash can. You're all done. Record the date of your injections on a wall or phone calendar. Thanks so much for watching today. I hope you found the video helpful. If you have any questions, reach out to your healthcare professional or call 844-MY-ADBRY. Remember that by signing up for the Adbry Advocate program, you'll get access to ongoing support, including information on benefits, programs to help you save on Adbry, online resources, and so much more.
Indication and important safety information. What is Adbry? Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat people 12 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids. It is not known if Adbry is safe and effective in children under 12 years of age. Do not use Adbry if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbry? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbry. Are pregnant or plan to become pregnant. It is not known whether Adbry will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbry during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting mothertobaby.org/ongoing-study/Adbry-tralokinumab/ are breastfeeding or plan to breastfeed. It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed instructions for use that comes with Adbry for information on how to prepare and inject Adbry, and how to properly store and throw away, dispose of, used Adbry prefilled syringes and auto-injectors. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single-dose prefilled syringe with needle guard or as an auto-injector. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injections of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. In children 12 years of age and older, it is recommended that Adbry be given by or under supervision of an adult. If you miss a dose, inject the missed dose as soon as possible. Then continue with your next dose at your regular scheduled time. If you inject too much Adbry than prescribed, call your healthcare provider or call Poison Helpline at 1-800-222-1222 or go to the nearest hospital emergency room right away. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis, Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include upper respiratory tract infections, eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.